So it falls to me to open the webinar with this short presentation to provide some context for the discussion to follow. In it, we hope to pose questions which will help you towards finding the right solutions for your individual circumstances. I think it's clear to reflect that actually one size does not fit all in terms of control. So we need to think about what others are doing and think whether that fits for us or not. So sometimes setting the right questions is the most important things. But before I go on any further, let me please introduce your panel a little bit more. So first of all, Louise Hoskin. Louise has been an IOSH Vice President since November 2017. She is also the chair of the Chiltern branch and a member of the consultancy group. Outside of IOSH, she is a risk management specialist with over 29 years experience, working alongside teams in international and national corporations and small and medium enterprises in a broad spectrum of industries. And next we have Jonathan Hughes. John has been on council from 2015 and has been an IOSH Vice President since November 2017. He is a past chair of the Staffordshire branch and is currently its vice chair. John is a highly experienced health and safety leader with a history of working globally across a range of public and private sector industries. He specialises in OSH leadership, management and strategy. He has a particular expertise in the application of ISO standards. And to myself, Duncan Spencer, I have over 30 years experience of applying a risk-led and evidence-driven approach to safety, building my knowledge through working in many different industry sectors and government and public organisations. This includes agriculture, education, construction, retail, logistics, healthcare, charities, uniform public services and manufacturing. My experience extends to working in the UK and also with some experience overseas. So now I've introduced your panel, let me begin with a presentation to give you a few thoughts that will start us all off. So feel free as I'm going through this presentation to raise any questions for the panel that you might wish to ask. So we're going to use three lenses today to look at the role of the OSH practitioner in this pandemic crisis, and they are the workplace and legislative compliance, OSH management systems, particularly focusing on risk management, and thirdly, human factors and behaviours. As we proceed through this presentation, I'll try and pose a lot of questions, but I'll do that deliberately in order for you to be able to think about that question and what that might mean in terms of a solution for yourself. So let's begin with the first one of those, which is workplace and legislative compliance. So there are a number of questions that I've heard fellow practitioners asking around this, so I've tried to capture them here. Do OSH laws still apply during disrupted working, i.e. lockdown or phased return? Well, the short answer to that is, of course, yes, they do. That is the case across the globe. But how we argue our compliance might need to change. And what I mean by that is we might have to modify our controls, and therefore how we describe our compliance will subsequently change from that. The next common question I often hear is, will there be a change to OSH legislation? Well, one prediction that we've been thinking about here at IOSH is that perhaps governments will be so focused on economic recovery after the pandemic that they will not have the room for considering new OSH legislation. Prior to the pandemic, there was some evidence that actually there was a reliance shifting towards international standards rather than towards more localized legislation. Because international standards are easier to form and amend, and of course they do serve the global economy. So that's a thought you may or may not agree with, but nonetheless, it's one to think about. Next, we've got how will operational practice change in your organisation? What does that mean for your OSH risk portfolio? The OSH practitioner must recognise new working practices will bring new risk. They'll affect your existing risk assessments, and they'll even eliminate some risks on some occasions. It is a key responsibility for the OSH practitioner to identify and advise on these changes. More of this in the next section. How do you manage the competency challenges of redeploying workers to infill gaps and employ temporary workers? Competency is key in the legislation of many countries, and obviously it's something that we will need to discuss at some point during today. I'll come back to this later on, but essentially we need to think about induction training, modification of existing training in order to be able to incorporate our COVID-19 considerations. And of course, don't forget about vulnerable workers. They are at greater risk, and under most legal jurisdictions, we have specific obligations to protect them. And of course, it's morally right. So no doubt these legal questions will raise further questions and challenges for you. And I hope for a healthy debate on them. But moving on, the second lens is OSH management systems. So there are a number of questions here perhaps you could ask yourself. So firstly, do you understand the biology of the virus and how it may be transmitted and spread? Have you identified the activities and locations where the likelihood of transmission is increased? Have you employed the hierarchy of risk control to develop control strategy? Does your risk control strategy include how to identify workers with the disease and incorporate social distancing? So a couple of points to think about on those questions. Risk assessment is fundamental to the OSH practitioner's role. It provides discipline and structure. It describes a picture, analyzes the problem, and this record can then help to justify your operational decisions. The elements include, of course, understanding the activity, identifying the hazard and how it may be realized, so in this case, how the virus may be transmitted, and then describes what can be done to reduce the likelihood of transmission. It's important to remember that risk assessment is not an exact science, but if the right people are involved and the right information gathered, it is a powerful way of supporting decision making. It is the duty of the OSH practitioner to lead the review of existing risk assessments and creation of new ones. A risk assessment doesn't control the risk, of course, it's only a document. The OSH practitioner's control recommendations must continue to employ the hierarchy of risk control. So start at the top of the list and ask yourself, can transmission be avoided? If not, can it be isolated or confined? What needs to be done to achieve that? What do people need to know and do? How do we need to modify our operational activity? Note that PPE in general is the least effective control. Placing healthcare aside, in other workplaces, the World Health Organization suggests that there is little scientific evidence that supports gloves and paper masks as having being effective controls for controlling the transmission to your employees. In fact, social distancing and good ventilation are far better than masks, and routine and regular hand sterilization is often more effective than a reliance on gloves. But certainly there are some arguments for both sides of that particular opinion. And IOSH will do its best to be able to represent both so you can make a informed decision. Other control considerations, as you can see here, there are just a few examples for you. But I think the OSH practitioner must think about who will do what, where they will do it, what they need to do in order to get things done, what can be done to modify workplaces, what can be done to modify workstations, and how people use them. The OSH practitioner in making all of these fresh thoughts and new perspective must be agile, creative, and flexible in this thinking. And please don't forget the basics. We still need to make sure that organizations don't ignore our other significant OSH risks. COVID-19 only brings a new dimension. Otherwise, it is business as usual. So for example, don't lose sight of the risks associated with running safe buildings. We are all learning fast, and no doubt our business continuity or pandemic influenza plans fell a little bit short in the past when we came to implement them. So we must capture this learning and enhance the plan for next time round. I think that's a key point that many people are now thinking about. So systems considerations, the OSH practitioner should also ask themselves, for business as usual OSH risk, where can control be relaxed or achieved differently? Where must we absolutely not compromise on the controls that are necessary to be able to keep people safeguarded? There will be some risks where you can modify your approach to make it easier to operate without adversely affecting the level of risk. So we need to be able to identify those kinds of things. But don't forget your business as usual. Don't forget things like vehicle and pedestrian segregation, slips, trips and falls, confined spaces, etc., etc. Next question for you is, how would COVID-19 response be incorporated into the organisation's governance arrangements? What reports need to go to the board? Let's face it, leaders are worried too. So think about how you will keep them informed. Think about how you engage with them and how frequently. Another question might be around your business continuity plans once again. So what have you learned? Have you incorporated what you've learned? Have you refashioned your plan ready for the next time round? No plan survives first contact with the enemy. And while most of us had business continuity plans, we have learned so much since. The OSH practitioner must assist with this review and amendment, and we need to return to work knowing that there is a possibility of a fresh wave of infection where this plan might be needed again. Does your wellbeing system adequately cover the mental ill health risk arising from COVID-19? I'll come back to this point later on. And of course, there are financial implications in what we do. So for example, if you are going to increase the amount of cleaning that is done in an environment, so you've got more cleaning more frequently and deeper, then that's going to take some funding to be able to do that. So there will be other business disciplines that you will need to go and talk to. You'll need to talk to facilities and finance and personnel and think about how you will find and fund the right solutions to keep our colleagues safe. And finally, in this particular section, we have recruitment and competence. I said I'd come back to this later. So the OSH practitioner must ask themselves a whole host of questions here. How do you keep up to date with the daily changing information on the pandemic? What do workers need to know? What do they need to do? How will you ensure that first-line managers know how to supervise effectively in these new working conditions? How do you discuss controlling the COVID-19 risk with contractors? Remember the three risk questions with contractors. What are their risks to you? What are your risks to them? And what combination of activities between the two of you might give rise to new risks? So there are three things that you should be talking to your contractors about. How do you identify and deal with the COVID-19 myths? What operational risks may change and intensify? For example, some key workers that are out there doing their job in all honesty, in good faith, are now being attacked by members of the public that are ill-informed and thinking that these people are going to spread the disease to them. So there has been a spike in violence and aggression in some places. So we must bear in mind that COVID-19 knowledge continues to grow. Since February, would you believe, there have been some 6,000 academic articles written on the subject. Is it any wonder that we as OSH practitioners are still struggling to be able to find out what is truth and what is myth? Suffice to say that my team at IOSH, in partnership with the strategic team, are doing our very best to keep across all of these changes, taking regular guidance from the World Health Organization and other global partners. Our communications colleagues are publishing regular updates on the IOSH coronavirus webpage for your benefit. On a different note, recruiting people, moving workers to other vacant roles and working with contractors, they all bring those competency challenges, and the OSH professional has a responsibility to think those through. What effect does that have on induction? What effect does that have on training needs? And don't forget, we've got lots of really good media channels and communication techniques and so on that we're well used to, that we can use to keep people up to date with the changes in COVID-19 information. And so to our last lens, which is the human factors and behaviours. So changing perceptions, more questions that will define the OSH practitioner's role. How do you monitor and react appropriately to changes in behaviour, attitude, belief and motivation caused by the pandemic? The pandemic is forcing new working arrangements that may well become the new normal post-pandemic, for example, virtual working. So what are the implications for risk and OSH management system design? Many workers will be anxious or even depressed after being furloughed or working from home. What must be done to support them and rehabilitate in the workplace? Society, its citizens, in fact our workers, may demand that all businesses become much more health focused in the future. There may be new collective behavioural expectations that come out of this. So what are those implications? What new things will you now need to think about and do? What do you have to do? Who must you regularly communicate with? And what do you say in order to stay stay as the organisation's trusted advisor and its critical friend. So let's address a couple of those points that come out of those questions. First of all, the way workers behave is crucial to OSH success and creating the right safety culture. New ways of working have been forced upon us. New working conditions have become necessary. Some things being predicted for the future are now with us today. Home working, virtual meetings, all of those kinds of things. So we have to embrace this new world as OSH professionals. We have to think about how that changes things. If OSH practitioners are to remain their organisation's trusted advisor and critical friend, they have to identify and understand all of these changes. There is a need to have regular conversations with managers in other functions. You need to pick their brains. You need to get their perspectives on how things are changing or likely to change. Such preparation is invaluable if we are to prepare new or amended preventative controls. And of course, well-being has become a focus once again during this pandemic. Working from home, being furloughed, and even losing loved ones to coronavirus will all take their toll on many of our employees. This will help to fuel a change in perspective. Our workers are citizens and part of our society. Changes in perception will develop a new consciousness about health, and organisations will need to meet these expectations if they are to protect brand and attract the best workers. So that's a few ideas to throw out there to you guys, and to think about whether you've got any further questions that arise from that short presentation. To start things off, what I'm going to do is ask both Louise and John a question, and then we'll move over to your questions. So let's begin by asking Louise if she would like to say more on reawakening buildings and returning to business as usual for the OSH professional.
Thanks, Duncan. So for me, and in terms of what we can do as OSH professionals, it's really use skills and that we have to our fullest. And Duncan spoke really eloquently about risk assessment. And I guess one of the things that we have done is we've looked at all of those roles and responsibilities that people have, and we've started at the top of that cone and said, well, what is it that we can eliminate? What work is it that we absolutely have to do to keep our business maybe ticking over? And what's the roles, what's the work that we can actually avoid? And certainly when I've been giving people advice, it's been around, particularly if you've got high risk working, we can avoid doing that. And it's only doing those essential tasks. But what is essential as we move out of this crisis really starts to change and alter as we start to come back online. And I think we've seen that in other parts of the world. So as we come back online, we need to be using our skills to really support business so that those activities can start to happen safely. And I think that's going to mean making sure that we maintain social distancing, making sure that we maintain hygiene controls, and that we do actually start to turn on the tap very slowly, and understanding there's certain activities and certain roles that probably won't be going ahead. And I think we also need to think about how people are going to feel from, we've all been working from home, and how are we going to feel as we go back into the workplace? How are we going to adapt to those jobs that we were doing before? Are we still going to, is there going to be an element of confidence lost? I was speaking to somebody yesterday who said, they haven't gone anywhere in their car for quite a period of time, and they actually felt car sick when they started back at work. So I think all of those things we need to start to think about, and that's where our roles and our skills can really come to the fore.
Thank you, Louise. And I'd like to ask you, John, to give us another perspective, if I may. Could you give us some reflections on what differences you've observed across the world and the subsequent challenges they pose for the OSH professional?
Yeah, thank you, Duncan, and a good question. And again, good afternoon to everybody that's on the webinar today. I guess fundamentally we're all in this together. So whether we're here as I am based here in the UK or anywhere else across the world, we're seeing similar challenges. For example, according to the UN, 191 out of 195 countries across the world have school closures, either in full or in part. So the risk and the controls and the social isolation that we've got with COVID-19 is absolutely there, pretty much right across the entire planet. I think some of the things that we're spotting in different countries that certainly pose some challenges, again, right across the piece, a general lack of clear, consistent guidance. Duncan, in your presentation, you talked about masks briefly, and that's a very hot topic right across the world. Culturally, there's parts of the world where wearing of masks is routine, business as usual practice anytime, let alone in a situation such as we are now, for example, in the Far East. It's routine wearing to wear a mask. In the UK, broadly, people don't wear face masks. We've got clear guidance from Public Health England, the HSE, OSH over in America, stating that masks are not required to be worn outside of a clinical setting. And yet here within Europe, for example, in Germany, Czech Republic, Slovenia, to name just 3 countries, it is mandatory to wear face masks in public places, on public transport, etc. And I suspect it may only be a matter of time before we perhaps see controls like that being more implemented here in the UK, particularly I'm thinking, for example, on the London Underground, whether we'd see a time when public transport here in the UK, it's mandatory to wear a mask. So the staff then take the mask off when they arrive in their workplace, or are there additional masks that they can then change into when they get into work? Just looking through the questions that some of the delegates here on the webinar have posted. There's a great question stroke statement saying, is a face mask, for example, PPE, or is it actually an engineering control? Is it a barrier? I think people generally perhaps misinterpret the purpose of the mask. The mask broadly is not for the virus to come to you and for that mask to stop it. It's for you to stop shedding the virus potentially out to other people. So again, it would certainly be good to get some clear guidance and advice in a non-clinical setting to give OSH practitioners like ourselves some thoughts and suggestions on what we can do. Touching again on some of the comments that you made, Duncan, and also Louise, one of the big challenges globally right across the piece is going to be as we reawaken our offices. How do we deal with countries still implementing social distancing rules? For example, here in the UK, if we start to reawaken our workplaces to maintain the Public Health England guidance of 2-metre separation, one of the biggest limiting factors there is going to be the access into the office. I work with a client that has circa 6,000 staff in one large 38-floor office building in the City of London. So if the lift capacity due to social distancing can only hold 2 people perhaps per lift carriage, and they've got a bank of, let's say, a dozen lifts, then that's going to take an awful long time to be able to get people into the office, let alone to be able to start doing some work. And then it's the management of people outside the lift lobby area, controlling and separating people to keep the 2-metre distance is only going to mean that organisation can probably at best have maybe 5, 10, 15% occupancy of their workplaces. So the challenges globally, again, of reintroducing people back to work is not going to be a quick fix. The Czech Republic, for example, they are looking at having full opening of all their social activities, so bars, pubs, clubs, hotels, etc., by the 8th of June. They're well ahead of the curve compared to here in the UK. And as they do that, again, how do they maintain social distancing? How are countries and workplaces going to play their part in preventing a second spike? We're starting to see, for example, in Singapore, a resurgence in the COVID virus there, and they're now implemented back in the 8th of April. Total lockdown in Singapore, which up until that point had been held as a shining example of how to control the virus. So it's a great challenge wherever we are in the world. For the OSH professionals out there, for workplaces, for the general public, I don't think there's anywhere that's not going to be facing significant challenges. It's our role as OSH professionals to help support our employers and our clients as best as we possibly can. And again, hopefully over the course of the rest of this webinar, we can explore some of the ways we can do that.
Thank you very much, John. So let's start to take some discussion and answer some questions from the floor. They're flooding in, so thank you very much everybody out there for your questions. So without further ado, one of the key topics that are coming up in the questions at the moment is, how do you deal with fake news? To use the Donald Trump phraseology. It's it's very clear that there are myths that have been created in and around COVID-19. There's misinformation that's been floating around and so on. So what advice have you got to give on how to keep to the truth and keep accuracy, if you will? Who would like to take that?
This is really important. I think, again, you know, if we're looking at the role that we play as OSH practitioners, it's important that we work from a position of fact. And we know that there are trusted websites and trusted places to go for information. I think IOSH has done an amazing job to create a whole portal on the website with useful links and useful information, and has partnered with the World Health Organization and ILO. You know, just bringing these webinars will signpost people to the right places. And I think, you know, we're starting to talk a lot about our mind health as well. And actually you can overload with this information at the same time. So I'm going to talk a lot about risk assessment in this session, because for me that's what it comes down to. And we also need to think about and assess the type of information that we're using, that we're taking note of. But I do also think we need to listen to our people too. I think that's really important.
Thank you, Louise. Yes, some good points there. I think flipping that question round, it's also how do we manage the impact of some of the fake news? So, for example, here in the UK, the telecoms industry, if you look in the press, you'll find examples where mobile phone masts, for example, have been burned down, vandalised, due to fake news spreading that the 5G rollout in some way is connected to spreading or creating the coronavirus. The impact of that, we must consider business as usual health and safety too. So for those OSH professionals who are helping to support workers going out right now into the community, key workers, people working in supporting residential units, for example, through fire risk assessments, or people working in the telecoms industry, we must also be risk assessing that and considering the risks to our workers, maybe doubling up or increasing the way that we work. Just to tackle that point about the 5G, we need to look at, for example, a country like Iran, where there is no 5G rollout, and yet Iran still has huge cases of coronavirus. Clearly, there's some fake news there, and there'll be other examples like that. It's again around, as OSH professionals, bringing that back to us. How do we manage that risk for our workers who may be affected by that fake news?
Thank you, both of you. And picking up on another theme that one or two people have asked about, and on a separate topic, there have been some concern about whether you should take the temperature of employees and whether that is a good thing to do, a bad thing to do, or whatever. So what are your views on that? Jonathan, would you like to go first this time?
Yeah, great question. So with temperature checking, I think the jury is very much out on that in the absence of there being any clear guidance. And I was searching for this as recently as late yesterday afternoon to the evening. The World Health Organization, OSHA, HSE, any other global source of reliable or reputable information, there's no guide that I can yet find internationally that suggests that taking temperature of individuals is right or wrong or other. There's almost complete, total silence on it. I guess there's the positive, yes, if we can identify that somebody has a temperature over 38 degrees, that could indicate there's a risk that they may have COVID-19, but they may also have an ear infection or toothache or various other different conditions that's also raised their temperature. There could also be false negatives, so somebody could be displaying a so-called safe temperature, but that may be because they've taken ibuprofen or paracetamol or something else to bring their temperature down prior to that point. How do we physically check temperature? Do we have infrared camera sensor systems that can mass test people like they're rolling out in some parts of the world into things like airports and railways? That might be fine if you're a major global organization that's using offices in Canary Wharf or city centre locations where that kind of resource could be deployed, or again, you are a public transport worker, for example, with the average workplace. If it's then down to personal testing, who's going to do that? So you're going to procure some infrared forehead sensors for people, like I may have in my house for testing the temperature of my children. And who does the testing? Does the employee do it themselves? Do first aiders do it? How to protect the first aider from potentially contracting the virus if they're checking the temperature of somebody? So I think there's many questions to answer. I think the jury's out at this stage. I think in the absence of some real clear definitive guidance, I guess that's down to a risk-based approach, and for OSH professionals to take an informed risk-based decision.
Yeah, I mean, absolutely. It's about risk assessment. When we've got so many variables as we have in this situation, it's using that fundamental risk-based approach. I mean, in terms of temperature, we know that in Asia that's used quite extensively, and that brings in the variable of differences in culture as well. I've worked with a care provider where they have been using temperature testing of their vulnerable residents in particular, because if they know that they're, if there's changes in their vulnerable residents, then obviously they can change their care plan, but also they're going to protect their staff. And they've had some really interesting, right at the beginning of the criteria, where somebody's temperature just shot through the roof within a really short period of time. So my view of it is that I think there probably is a place for it, but we need to, as you know, this is something that we can work with our businesses, with our organisations, to actually take those variables, put them through a risk-based model. There is no clear guidance, so we've got to work with those around us, and we've got to listen to those around us. We've got to listen to the guidance that is there to make those kind of decisions going forward. And what's right for today might not necessarily be the same for next week. So we're in a constantly moving situation, and we need to get, there is no black and white. We've got to start being professionals that are used to living in the grey.
Thank you both. Very comprehensive answers. Perhaps we can pick up on one of those threads, because again, that is a question that's being asked by a number of people, and maybe dig into a little bit more about what parameters to include within the risk assessment. So while you're thinking about that, one of the things that I've been thinking about from our perspective is, how is the virus actually transmitted? And we know that it's actually transmitted in an aerosol, and that aerosol, that small moist particle containing the virus that you get exhaled through your speech or through your breath or through coughing and sneezing, obviously, and so on, is what we need to avoid. Yes, it does go down to surfaces. I understand that. Yes, you can pick it up from a surface, but if we can do something that actually reduces that aerosol, then that's got to be a good thing, or exposure to that aerosol. So that's where social distancing comes in. So if you're in a situation where you're working with another person, then work at least 2 meters away, as we know by the advice. But I know that in the food and drink industry, for example, sometimes that's very difficult when you're trying to operate production lines. So the least you can do is actually stand back to back so that you're facing different directions. That might be the best you can do from a pragmatic perspective. Other things that we might consider is whether ventilation might help. We've got a piece of IOSH research that's coming out. It's going to be published in a couple of weeks. It was specifically about people who are suffering viral diseases in hospitals, and how you can reduce viral loading from people breathing out and so on. And it was very, very clear. If you have ventilation that depresses or blows away that aerosol, you significantly reduce the viral loading on things. So that's something to consider if people are working outside, for example, because actually their loading won't be the same as working in an office, and even less so than people who have to share a cab of a vehicle or something of that nature. So those are the kinds of things about understanding the biology, which I think is really quite important in leading you to the right controls. So Louise, have you gotten any other thoughts on the kinds of things people might want to consider in their COVID-19 assessments?
Yeah, I mean, the whole piece around PPE, I know is has thrown up loads of different angles, and I'm really personally going through this on a risk assessment basis with a variety of organisations. I believe that the IOSH are looking to the World Health Organization for their guidance, which I think has been very pragmatic. I agree that face masks, technically surgical masks worn by the general populace, which I know in parts of the world is being undertaken, that's not strictly speaking PPE. It's protecting, you're wearing the face mask to protect yourself in case you're a carrier and are not aware of it from others. But I've also had to deal with situations where people feel like that they are seeing this and they want to wear a face mask, but actually that's encouraging you to constantly touch your face. You know, if you've mentioned the food industry, you know, it's not a hygienic thing to be wearing if you're preparing food and working in the food industry. So, you know, it's down to risk assessment again and down to the exact situation that you're in. But I think that the advice being issued by the World Health Organization is pragmatic. And certainly that's what IOSH is backing up at the moment.
Thank you, John.
Yeah, some really good points there, Louise. I think as well as that piece around reassurance. So whilst a mask may or may not be effective in controlling the spread of coronavirus for the individual who's wearing it, if that enables somebody to be more reassured to get them on public transport and then into an office or into the workplace, then again, it also has some positives in that regard. I think just broadening the topic out, Duncan, into wider risk to consider as we start reawakening our workplaces. Obviously, workplaces are vast and varied. We talked earlier on about Czech Republic, looking that by the 8th of June, all their workplaces will be open, including public places, bars, hotels, restaurants, etc. Things like social distancing in things like the global sports industry or the music industry. Whilst that may seem frivolous that we can't go and watch our favourite Premier League football team or our favourite cricket match right now, nevertheless, that is a multi-billion-dollar industry supporting hundreds of thousands of jobs worldwide. How do we manage the risk of crowds? Will we see any kind of stadium reopening for months, weeks, maybe into next year? I understand here in the UK, one of the football chiefs is suggesting that we may not see stadiums being reoccupied again until 2021, which again has a massive impact on the sports industry. We're bringing it back to basics, things like hairdressers, things like schools. How do we maintain social distancing for 1,000 children in a large secondary school, for example? There's going to be all sorts of challenges there to try and manage that risk. From an office-based approach, then yeah, we can look at distancing within the office. Areas such as closing down certain banks of desks. If there's a row of 4 desks in a row, can we take out the middle 2, for example, and just leave the end 2? But then what about things like, as I mentioned before, getting into the office through the lifts? What about the food prep areas? Look at cleaning regimes in terms of cleaning down door handles and other key touch points, removing things like hot desking facilities. We don't want somebody to arrive on their laptop, work on a shared keyboard and a shared desk space for half an hour to go into a meeting, but then a second person to come along and potentially be contaminated. So right across the piece, whether it's hairdressers, whether it's a pub or a restaurant, a sports stadia or an office, there's going to have to be some fairly significant changes even to think about reawakening these workplaces, let alone starting to transition towards business as usual, however that may look in future.
Yes, I mean, you mentioned lifts again there. This is what I meant in the initial presentation about being creative, I think, and being agile and flexible in your thinking. Because if you know that you've got a 8-story building and you've got people who need to use lifts, and you've got a couple of hundred people, maybe even 1,000 or so, that need to be using those lifts to get up and down that building, then we need to be creative in what we do. You can't simply say to people, use the stairs, because all you're doing is then pushing everybody onto the stairs. It's not really going to achieve anything, possibly. But you could do flexible things like reorganize start and finish times for people, so that you've got staggered starts and staggered finishes, so that you've not got everybody trying to get in the morning at the same time and not everybody trying to go home again at the same time. Again, maybe rotating days in the office and days at home, and those kinds of things. We have to be really quite flexible in our thinking about this.
That's going to be really important, because as we, the economy has been frozen. So business, it feels like it's effectively stopped. And that's not something that's sustainable. So when we start to reopen our, workplaces, those businesses need to get themselves back onto a footing. And, we know that there's certain industries that have been completely decimated. So the leisure industry, the aviation industry, so the role that we have as OSH professionals is to really adapt to the fact that those leaders in those industries are going to be really focused on getting those businesses back and up and running. So you know, how can we help and how can we support them in that endeavour? And I think that flexibility in thought is going to be absolutely critical, and we need to demonstrate that in spades, because at the same time we've got an opportunity here to show that, you know, the health of the nation, we've all seen how important that is and how critical that is, and certainly the organisations that I've worked with that have fared the best in this had the best systems in place. So coming out the other side, there's a real opportunity for us as OSH professionals, but we need to be sensitive to business. We need to walk alongside them and support them, and involve them in our decision-making processes. Because after all, they run these businesses, and they need to be the ones who are doing these assessments as well. I mean, one of the pieces for me is that I've seen, you know, senior managers actually sit down with a risk assessment and really go through that process. Show me how you do this, show me how it works so that I can evaluate this fully for my business. So that, you know, they're opening up more than I've ever seen to how we work, but we need to be there on the other side of this and be sensitive to that at the same time, I feel.
Yeah, very good points, Louise. Again, for those organisations out there that are perhaps certified to something like 18,001 or the new international standard of 45,001, then we can look around that planning and that leadership engagement, Louise. Again, absolutely fundamental key parts of ISO 45,001 for those organisations that have that. You know, the consultation, the coordination, the cooperation, having that leadership engagement, absolutely crucial. And also, again, thinking around the broader risk. So to get back to that point again, Duncan, about getting people into the office is a challenge in itself. So we're looking at carry on with flexible working, agile working, etc., but not losing sight back to basics. Getting them in is one thing, getting them back out is another challenge. So things like an orderly fire exit. Imagine if we've got any number of people in the office, how do they maintain an evacuation from that workplace whilst also maintaining the 2-metre safe distancing? There's all sorts of impacts that this is going to have for the OSH professional to consider.
Thank you both. Okay, another thread that's within the questions that I've just picked out here is around controller contractors. So there was one question, for example, that was asking, if you are a contractor and you're working for another organisation and you feel that their controls aren't adequate in terms of protecting your workers while they're working in that situation, what should you do? And I suppose that question kind of opens up the remit, doesn't it, in terms of controller contractors is a very key feature for the OSH professional. It's a very key subject matter for us, and there are significant implications around COVID-19 that are exacerbated by the fact that, you know, you can't control another organisation. You can make requirements of them, maybe. So maybe we can unpack that a little bit. Jonathan, would you like to go first?
Yeah, thank you, Duncan. So again, controlling contractors opens up a whole vast array of things to discuss. We could fill another 1-hour webinar on that. Maybe that's a topic for another week. The direct impact of that is multiple. For example, there could be organisations out there where they've closed down their offices or their workplaces. In doing so, they've also cut out things like their Legionella and water hygiene testing. There may very well be buildings out there, in fact I'll be stunned if there aren't, where the contractors haven't been arriving at site to carry out, you know, essential PPM maintenance work, which is going to have a direct knock-on effect if those buildings are still got systems and services running, and there's been a Legionella water hygiene testing carried out on that for potentially now at least the last 3 or 4 weeks since we went into lockdown here in the UK, let alone other parts around the world. Yeah, that could have some profound impact. I hope we're not sitting here in months to come looking back at a potential another Barrow situation where there's now been deaths caused by a Legionella outbreak. Thinking directly in relation to the question around what do we do if we are the contractors and we feel that there's not sufficient safety measures put in place, I don't think there's any difference actually whether we're sitting here talking about COVID or whether we're talking about potential work in a building that contains asbestos. The risk is still present. The risk may have varied. It's a different type of hazard we're now looking at, but the underlying principles that we would implement any other time would still apply, not least of which is consultation, cooperation, coordination, raising the questions and the concerns with the relevant parties, seeing if we can come up with a reasonable explanation or a reasonable method of working to move things forward and resolve whatever the concern may be. And ultimately, if there's a reason to believe that the safety implication is that serious, then of course we look at alternative ways of working or cease working.
Louise, would you like to add anything?
Yeah, so contractor management, it can be the most challenging thing that a business has to grasp in terms of, you know, how we manage our contractors well. But when a contractor comes onto your site, they have a right to a safe place to work. And in order to achieve that safe place to work, we've got to work together. So, you know, the contractor themselves can't make, neither can make those decisions in isolations. They need to work with themselves. You know, I've had a situation where we had a contractor withdraw from a really vulnerable workplace, which caused an awful lot of issues and problems. But actually that is about working together. You know, what are your concerns? It's about communication. How can we deal with those concerns? What are the controls that we can put into place? And I think there are additional controls that can be put into place to reassure those contractors, and also to have a real zero tolerance view of this. So if people are not following the systems and the rules, you know, that's it. You know, the rules are there, they've got to be stuck to. And if you know, people aren't following those systems, if it's the client themselves, then that needs to be escalated. That's a leadership issue, because we need those contractors to come back into our workplaces, but we've got a duty to protect them too. So it's I suppose the short answer is we need to work together on this in a way that we've never done before, perhaps.
Correct. I think that working together and that collaboration, that's crucial, not only obviously within our own workplaces and looking at it through a narrow lens of the employers that we work with, but also looking at it from the global perspective. What can IOSH and other bodies do to help spread good practice to other parts of the world? If we start looking at managing workplaces in other countries, in Asia, for example, in clothing manufacture, could be construction sites in the Middle East, to try and maintain social distancing rules there is going to be extremely difficult. So it'd be good to see, again, some additional guidance from WHO and other global bodies to help advise or guide other workplaces right across the world in being able to come up with some practical and pragmatic solutions.
Well, as usual, with these webinars, we're running out of time, and we've got 407 questions in the question stream. So I'm wondering if we could just
afternoon, Duncan.
I'm wondering if we could just cram in a quick 1 minute from both of you on this, if you would, and then I've got some final questions for you. But there's a thread here. Several people have been asking about DSE risk for home workers, particularly because people have been sent home with laptops and what have you. So in just 1 minute, can you just give a few tips for how that can be managed, please? Louise, would you like to go first?
Yeah, I think we all need to be a little bit creative with this. Some of the guidance that I've issued is you know, use a good cushion, which might help, you know, and look around at the house at the kind of things you might have in a workplace. You might have a nice footstool. Well, actually, can you use a pile of books? You know, cushions. You know, what I think we've all got to be a little bit creative, and also I think we need to take more breaks, says the person who did a 12-hour day yesterday, on going from one Zoom call to the next. But I think regular breaks are really important. If you have some outdoor space, just you know, take more frequent breaks, and be kind on yourself, and appreciate that you might not get done as much as you do normally. So I think we need to try and meet the standards that we know exist, but actually we need to also adapt to that too, and look for some clever ways to make our workstations more comfortable. But if you do have a particular injury or whatever, then you need to go back to your line management and say, look, I need something more. This isn't working for me, because we've got to stay in contact with each other at the same time. So employers are still employers.
And thank you. And Jonathan, have you got a couple of tips, please?
Yeah, I just think, conscious of time, Duncan, to reflect what Louise stated there. Again, from a UK perspective, the UK Health and Safety Executive have changed their guidance and advice on home working and DSE, and they generally reinforce what Louise said there. I think it's getting that message across to our employees that, look, these are unprecedented times. Please bear with us. We're not going to be supplying desks, chairs, monitor risers and footrests to any number of workers in your homes. Be flexible. The HSE advise you, trying to support yourself with cushions and find a comfortable place to work and be flexible.
Yeah, and the only thing I would add to that, and this is, I stress this is from my personal experience rather than setting any kind of policy, but the DSE cases that civil cases that I've been involved with in the past has generally been that people have created a chronicity of injury over a long period of time. We're talking about not months but years. To be able to get to those kinds of conditions. So I think in the short term, I don't think we're in any problem, providing that people are sensible about it and follow your guidelines. If the lockdown happens to go on for 12 months or more, then we might be in a different situation. And again, from risk assessment, we might need to take a view of that. Okay, so let me ask you a parting question to you both then. I'd like to just think about things from the OSH professional's perspective once again. What skills and behaviours do OSH professionals need to employ to help them to deliver effective advice in their organisations? So John, would you like to go first? Just a couple of minutes, if you would.
Yeah, great question, Duncan. All IOSH members on the webinar here, I'd encourage you to go and have a look at the IOSH Competency Framework. It's been released with 69 core competencies in there. And
thank you, Louise.
You've got that held up on screen. That is it. That'll provide you many of your answers in there. On the technical side, then certainly, as we've discussed the session, risk assessment now more than ever is our time to be absolutely spot on with our risk assessment approach. On the strategy and planning side, on the core skills, again, they're going to be absolutely crucial. On the behavioural side, working with others, communication, having empathy. This is a very challenging time for everybody right now. So we need to be good listeners, good communicators, very empathetic to our people. The IOSH Competency Framework, now more than ever, this pandemic is giving us a great example of where we need a multifaceted approach to our skills.
So Louise, business skills and behaviours.
Yeah, I mean, Duncan, you and I have spoken about this a lot. This is absolutely critical right now. So, we've at the beginning of the year, we launched this and we said, the technical skills are important. You need to have technical skills, but it's those, I don't like using the word soft skills because they're not soft. Power skills are really, really critical, and it's all of those pieces that are in there. The other thing that I would say is that we really need to use our listening skills right now. We need to work really closely with our businesses, and we need to maintain diversity of thought as well. So it's using everybody around us. It's having the experienced voices, it's having the business voices, it's having the people that are coming through that are new to the industry, because we need new ways. We're going to come out of this differently. We need new ways of working, and so we need to hear those future leaders' voices as well, and remembering that what fits in one work location, in one country, in one territory might not be the same in another. So we've got to adapt, and we've got to think differently, and not just listen to the loudest voice in the room.
So thank you very much to both of you for participating today and for your words of wisdom. If I can just share a slide with everybody to finish off. Just to finish off, let me do a minute or two just on summary. Today we have touched upon many things, and I think perhaps our biggest takeaway from this is that our professional training makes us exactly the right people to advise on the challenges that arise from COVID-19 and how that affects the operations within our different organisations. We have the tools that are necessary. You know, we have the tools to identify risk, assess risk, recommend the controls for risk and such like. And we need to have more confidence as individuals and collectively as a profession, perhaps, to meet and overcome these challenges and keep our people safe. We most certainly do have a vital leadership role to play in this crisis. And as I mentioned earlier, remember, this is the fourth of a series of webinars which will take place over the coming weeks. So keep an eye for on the IOSH channels for details on the next webinar. But for now, thank you very much for everybody joining us today. Thank you to Louise and John for giving us their wisdom and answering your questions. I'm sorry we weren't able to get to all questions, but as I said, your question is invaluable to us. It will help us to be able to formulate what webinars to have in the future. But for now, I would like to thank everybody for taking part, and do stay safe and stay well. Thank you and goodbye.